primary liver cancer is a life-threatening illness and one of the fastest-growing cancer types in the United States. Most primary liver cancer is cancer in your liver and cancer in the bile ducts in your liver. Both cancer types have common causes, risk factors, symptoms, and treatments. Healthcare providers focus on identifying who might be at increased risk so they can catch and treat primary liver cancer as early as possible.
Welcome to this health channel. Watch the full video to learn more about liver cancer.
What is liver cancer? Liver cancer is a life-threatening illness and one of the fastest-growing cancer types in the United States. There are two kinds of liver cancer, primary and secondary. Primary cancer starts in your liver. Secondary cancer spreads to your liver from another part of your body. Like many kinds of cancer, healthcare providers can do more to treat liver cancer during the disease's early stage. Unlike many kinds of cancer, healthcare providers have a good idea of what increases someone's risk of developing liver cancer. With that in mind, healthcare providers are intent on identifying who may be at increased risk so they can catch and treat primary liver cancer as early as possible. Is liver cancer a common disease? No, it's not common, but liver cancer cases are steadily increasing. Healthcare providers estimate about 1% of all men and women in the United States will be diagnosed with a form of liver cancer during their lifetime. There are three kinds of primary liver cancer. Hepatocellular carcinoma, this is the most common form of liver cancer, representing nearly all liver cancer cases. Intrahepatic cancer, this is a form of cholangiocarcinoma. IHC is cancer in your liver's bile ducts. It represents about 10% to 20% of all primary liver cancer cases. Angiosarcoma, this type is very rare, representing about 1% of all primary liver cancer cases. This cancer begins in the lining of blood cells in your liver. Overall, HCC and IHC represent about 2% of all new estimated cancer cases in the United States, and 5% of all new cancer deaths. Healthcare providers often diagnose and treat HCC and IHC the same way. Who's affected by liver cancer? HCC and IHC affect more men than women and are most often diagnosed between the ages of 55 and 64. People whose race includes Asian, Pacific Islander, Hispanic, or American Indian, Alaskan Indian are more likely to develop primary liver cancer than people who are black or white. What is the main cause of liver cancer? Liver cancer happens when something affects healthy liver cells' DNA. DNA carries the genes that tell our cells how to function. We all have genes that tell cells when to grow, multiply, and die. For example, oncogenes help cells grow and divide. Other genes, called tumor suppressor genes, monitor cell activity, keeping cells from multiplying uncontrollably and making sure cells die when they're supposed to die. When our DNA mutates or changes, our cells get new instructions. In HCC, DNA changes to turn on oncogenes and or turn off tumor suppressor genes. For example, studies show cirrhosis related to the hepatitis B virus and hepatitis C virus account for more than half of all HCC cases. When these viruses infect liver cells, they change cell DNA, turning healthy liver cells into cancerous cells. What are the early warning signs of liver cancer? Unfortunately, you can have very early liver cancer without any symptoms. If you know you're at risk for liver cancer, talk to your healthcare provider about tests to monitor your liver and possibly catch liver cancer in its earliest stage. How do healthcare providers diagnose liver cancer? Your healthcare provider may suspect you have liver cancer if they find liver cancer signs and symptoms during your physical examination. They may order the following tests to learn more. Blood tests. Healthcare providers may do blood tests for cancer, such as a liver function test, to check on liver enzymes, proteins, and other substances that show whether your liver is healthy or damaged. They may test for alpha-fetoprotein. High AFP levels may indicate liver cancer. Ultrasound. This test provides pictures of your soft tissue structures. Healthcare providers use ultrasound to look for liver tumors. Computed tomography scan. This special type of X-ray takes detailed images of your liver, providing information about liver tumor size and location. Magnetic resonance imaging. This test produces very clear images of your body using a large magnet, radio waves, and a computer. Angiogram. This test helps healthcare providers examine your liver's blood vessels. During this test, your healthcare provider injects dye into an artery so they can track blood vessel activity and look for blockages. Biopsy. Healthcare providers remove liver tissue to look for signs of cancer. Biopsies are the most reliable way to confirm a liver cancer diagnosis. Your healthcare provider may do the following tests if they think you may have IHC. Endoscopic retrograde cholangopancreatography. ERCP uses an endoscope and a catheter to examine your bile ducts. Percutaneous transhepatic cholangography. A PTC creates X-rays of your bile ducts like an ERCP. Instead of an endoscope and catheter, your healthcare provider delivers contrast dye by inserting a needle directly into your bile ducts and liver. A PTC is usually only for people who can't have an ERCP. What are liver cancer stages? Healthcare providers stage HCC using standards set by the Barcelona Clinic Liver Cancer System. This system evaluates HCC liver on characteristics, including whether your liver is working well, tumor size, and your symptoms. Healthcare providers may use different terms for each BCLC stage, sometimes presented as being stages I to IV or 0 degrees Celsius, or by terms such as early and advanced stage HCC. Hepatocellular carcinoma stages include the following. Stage I, very early stage. Stage 0, you have a single tumor in your liver that measures less than 2 centimeters. Blood tests show your bilirubin level is normal. Stage II, early stage. Stage A, you have a single tumor that measures 5 centimeters or less, or you have more than one tumor that measures less than 3 centimeters. The tumor may have spread to your blood vessels. Stage III, intermediate stage. Stage B, in this stage, you may have more than one tumor or a tumor that measures more than 5 centimeters. The tumor may have spread to your lymph nodes, large blood vessels, or another organ. Stage IV, advanced stage. Stage C, cancer has spread to other places in your body, such as your lungs or bones, as well as lymph nodes. How do healthcare providers treat liver cancer? Healthcare providers have several common treatments for HCC and IHC, including surgery to remove part of your liver, liver transplantation, and liver-directed treatments like hepatic arterial embolization and ablation. They may also use several types of chemotherapy, chemoembolization, radiation therapy, radioembolization, immunotherapy, and targeted therapy.
Subscribe to our channel to keep up with new content. Your subscription, support, and feedback are much appreciated.